Hi, I'm Bree. I'll be your nurse today. I'm gonna give us some privacy because we're gonna do a head-to-toe assessment. I'm gonna go and wash my hands. I'm gonna give us some privacy. Can I get your first, last name, and date of birth?
Colton Caldwell and 12406.
Okay. And then, do you have any allergies, Colton?
No.
Are you in any pain today?
No.
No? Okay, so I'm gonna ask you a few questions before we go and get started, okay? Do you know where you are?
The hospital.
Sure. And then, do you know what we're doing today?
A head-to-toe assessment.
And then who's the president right now?
Donald Trump. I mean, Biden.
Yeah, there you go. Okay, do you wear any glasses?
No.
No? Okay, and then, do you feel safe here?
Yes.
Do you feel safe at home?
Mm-hmm.
Do you have any thoughts of hurting yourself or others?
No.
Okay. And then, do you usually typically eat 3 meals a day?
Yes.
Okay, what's your breakfast like?
Cereal.
Okay, lunch?
Usually pizza.
Okay, and then dinner?
Like some type of meat.
Okay. All right, and then how much water do you drink a day?
6 cups usually.
Okay, perfect. All right, and then do you exercise regularly?
Yeah.
Yeah? Do you play like sports or something?
Yeah, I play baseball.
Okay, cool. All right, so we're gonna go ahead and get started. Do you mind if I feel your head?
No.
Okay. So I'm gonna go ahead and feel his head. Do you have any pain when I palpate?
No.
All right, so I'm looking for any infestations, and I don't see anything, any scars, lumps, which I don't feel. Okay, sorry, I lift up your hair. Okay, now I'm gonna go ahead and go down to his ears. Go ahead and just look forward. I'm gonna pull up and back since he's over 3. Okay, everything looks good. Other side. Okay, everything's good. Now I'm gonna go ahead and look at your eyes. Go ahead and just look straight forward, okay? Okay. Okay, now go ahead and follow the tip and just don't move your head, okay? There you go. Okay, now I'm going to just keep following it, don't move your head. Come on. Okay, good. So pupils are round, they're reactive to light, and the muscles of the eyes seem good as well. Now I'm going to go ahead and look at your nose. Okay, do you have any difficulty breathing through your nose?
No.
No, okay. Go ahead up to your mouth. Okay, go ahead and stick your tongue out and say ah.
Ah.
Okay, so the uvula is midline and it rises equally. The teeth and the tongue and the oral mucosa is all good. All right, so now we're gonna go ahead and move down to your chest. Can I have you take your shirt off?
Yeah.
Okay. So the skin is warm and it's dry. I don't see any lesions, scars, or anything like that. Do you have any pain anywhere? Okay, go ahead. I'm gonna check the skin turgor. There's no tinting or anything like that. I'm gonna go ahead and listen to your lung sounds, okay? Every time you feel my stethoscope hit you, just take a deep breath in and out. If you get lightheaded, let me know. In. Okay, I'm gonna have you turn around. Okay, same thing. Okay. So lung sounds sound clear. I don't hear any wheezing or anything like that. You don't have any difficulty breathing or nothing like that? Nothing sputum coming up? Alright, cool. I'm going to listen to your heart now. You can just breathe normal, okay? So listen to the aortic. Okay, pulmonic. Listen to the bell. I'm going to listen to the earth point. Okay. Like tricuspid. And mitral. Okay. So S1 and S2 were heard, the rhythm and rate were all good and normal. Alright, so now I'm gonna go, you can put your shirt back on. So inside out. No, you're good. Okay, so now I'm going to go ahead and look at your extremities while we're up here. The skin is warm and dry. If you had an IV site, I would check that, but he does not. Go ahead and flex your elbows like this. Good, and down. Good. Now go ahead and hands like this, and down. Shrug your shoulders. Good, down. Now go ahead and do with resistance. Up. Good. Down. And push up on my hands. Just push up like this. Good. And then down. Good. Squeeze my fingers. Okay, so range of motion and strength are all good. He has full range of motion. I'm going to do your capillary refill, so go ahead and put your hands like this. Okay, so the capillary refill is less than 2 seconds, so that's good. Now since we got that, I'm going to go ahead and move on to the abdomen, so go ahead and lay flat on the bed for me. Okay, good. And we'll lift your stomach or your shirt up. Okay, so from what I can see, there's no lesions, no scars. The skin is warm and dry. I'm going to go ahead and listen to his bowel sound before I start. When was your last bowel movement, or when was your last time you went number 2?
Last night.
Okay, and then was everything normal, no pain, color normal?
Yeah.
Okay, and then what about when did you last go pee?
This morning.
Okay, was everything normal?
Yeah.
Color was good, yellow?
Mm-hmm.
Okay, no foul odor, no pain. Alright, perfect. Okay, so we're going to go ahead and listen to his bowel sounds now. Do you feel nauseated or anything? Alright, cool. So we're going to start with the right lower quadrant. Okay, so the bowel sounds were heard, they're active and normal. I'm going to go ahead and percuss your abdomen. Okay, so it was tympanic, everything sounds good. I'm going to go ahead and palpate now. Let me know if you have any pain or tenderness, okay? Any pain or tenderness?
Mm-hmm.
No? Alright, I didn't feel any masses as well, so everything looks good there. I'm going to go ahead and do the lower extremities. I'm just going to kind of look at your skin. Okay, everything feels warm. Do you have any cuts or lesions on your legs, scars, nothing like that? Okay, does anything hurt? Okay, you don't feel any edema as well. Can I ever take off your socks?
Yes. Oh,
Okay, and then lay down. Go ahead and bring your knees to your chest. And then go ahead and do a butterfly with your legs. Good. And then go ahead and push my hands in. Go in. Good. And then out. Good. Alright, go ahead and straighten your legs out. Good. Now go ahead and raise your legs straight up. Good. Down. Good. Good resistance. Good. And down. Good. Now go ahead and flex your toes to you. Good. Down. Good. Now with resistance. Good. And down. Good. I'm going to do your capillary refills as well. Okay, so they're less than 2 seconds, so that looks good. She has a full range of motion and the strength is good as well. The calves don't feel warm or hot and they're not swollen. Can I have you get up and then walk to the door and then walk back?
yes.
Okay, so the patient doesn't have any troubles ambulating. Does anything hurt when you walk? Nothing like that? Alright, do you have any questions for me?
No.
Alright, so that will conclude it. Thank you.